Okay, so here we're going to start to discuss different types of infections that are going to be spread through the blood. And so, of course, this is very important because blood infections can spread anywhere. And so, if your pathogen gets access to the blood, then they're able to spread throughout the body. And so that can be a very serious infection, can lead to sepsis and shock and things like that. And so it's important to aggressively treat any infections that have or can be detected in the blood. Now, the infections of the blood can be of different sources. Bacteria, viruses, fungi, as well as parasites can all move through the blood. And so sepsis and septic shock are going to be an important potential outcome for these infections. So the blood has access to the entire body, so it can cause dissemination of your pathogens, which means they can move from location to location. And so they can start at infection in the respiratory tract, gain access to the blood, and then find their way to the skin, for example. Sometimes this is going to be normal, so the pathogen has an affinity for a certain area of our body, and so they're normally just going to pass through the blood. And then in some cases, though, the pathogens are going to lead to uncontrolled infection of the blood and a constant presence in the blood, which can become a very serious infection. So infections of the vasculature are when the pathogens enter the blood and then start to damage structures of our cardiovascular system. So these can be infections of the heart, endocarditis, the veins, thrombophlebitis, and our arteries. These are most commonly going to be caused by our normal flora bacteria, our streps and our staph. Bacteria endocarditis was what it was called previously, but it is now known that other pathogens can cause endocarditis. So fungus can also be involved in these. And of course, infections of fungi have to do with the immune status of the host, where immune-compromised individuals are going to be most susceptible. Now, these infections of our vasculature, of the cardiovascular system, are going to be very serious, can be very fatal. And you're typically going to be able to find the organism in the blood. So here's a picture of infectious endocarditis. And again, most of the infections are going to be caused by your bacteria. They are going to result in an influx of your innate response, and that leads to pus forming. And the pus and abscesses can form in your cardiovascular system. So inflammation of the inner layer of the heart is infectious endocarditis. And then this can lead to an abscess or a vegetative form. This can be caused by disease or by trauma, but of course we're more interested in the disease-causing infectious endocarditis. So this is primarily, again, going to be our normal flora bacteria, our streps and our staph. And it can also be caused by our normal flora fungi, Candida. Now, the infection of the valves can move on to the septa of the heart, as well as if there are any cardiac shunts. And then this vegetative growth, the abscess, can lead to a blockage. The immune system is not able to access if there is a blockage. And so treatments also cannot access, so antibiotics have a hard time. It's similar to what you would find a boil on the skin. The pathogen has sort of walled itself off. So some of the symptoms of infectious endocarditis are these splintering hemorrhages that are shown here on the fingernail. And these are basically just going to be bleeding. And then there's Janeway lesions, which are painless skin spots that are red. These are going to be present on the palms and the soles of a patient. There's Ulcer's nodes, which are red painful nodes on the pads of the fingers or toes. And typically a person will have shortness of breath as well as a swelling in their feet, legs, abdominal area. Now, the infectious endocarditis can be diagnosed by echocardiogram, and the sound waves basically are detecting these blockages, these vegetations. Also, you can test the blood cultures for bacterial presence or fungal presence in the blood. Now, our organisms that are going to be mostly responsible for this are going to be our normal flora. We have our strep viridans. That's going to cause a majority of these. The next is going to be our Staph aureus. We also have other streptococcus, which can cause endocarditis. Coagulus negative streptococci, which is basically our normal flora staph, which almost everybody is colonized with. And this would typically be a problem in people who are immune compromised. And then to a lesser extent, you have your enterococci, which can be drug antibiotic resistant endocarditis. So patients on antibiotics and your enterococci can move in because they have a lot of resistance. And also gram-negative bacilli can cause this as well. Now, septic thrombophlebitis is when you have a venous thrombus, and typically we think of deep venous thrombus, but when you have a suppurative or pus causing, this is inflammatory or caused by a pathogen. So venous thrombus with inflammation and with the presence of bacteria in the blood. You may see pus within the vein wall. So again, this is just your immune system trying to clear the bacteria, and they form pus. And then this can also have a perivascular inflammation as well. Patients will be diagnosed if they have persistent bacteremia after 72 hours of being on some sort of antimicrobial therapy. And this is typically going to be an antibiotic-resistant bacteria. They can have in the hospital infections through a catheter, and then blood culture will show evidence of the bacteremia, and you can also look for evidence of a thrombus using radiographs. Now, most patients at risk for septic thrombophlebitis are going to be burn patients, anywhere you have damage to your protective layers so that your normal flora bacteria can move in. Steroid use, so this is going to be naturally immune suppressive and is going to make your immune system not able to clear those normal flora bacteria. Intravenous injection, again, you're introducing potentially pathogens into the actual bloodstream. And an intravascular catheter, so somebody who's in the hospital nosocomial type infection. Lemire Syndrome is going to be this caused by pharyngitis or a dental infection, and it's going to typically present in the jugular vein. Dural vein septic thrombophlebitis is going to be a result from ear, nose, or throat infection, and the oropharyngeal infection or mastoids, meningitis type infections will have that.